So your healthcare provider or your health department asked you to monitor your health. And you're like, wait, what? Why do I have to do this? For how long? What if I don't know how? There are many infectious diseases out there, like the flu, Ebola, measles, MERS, chikungunya, Zika virus, and malaria. Some of these diseases have serious health risks and might not have medications yet to treat them. An infectious disease is an illness caused by germs, such as bacteria, viruses, fungi, or parasites. Infectious diseases can sometimes be passed between people, insects, animal bites, ingesting contaminated food, water, or organisms in the environment. You may be asked by a healthcare provider or your local health department to monitor your health. They may be concerned that you have been exposed to an infectious disease and want to properly care for you if you get sick and protect others from getting infected. Let's back up a little. You may recall during the 2014 West African Ebola outbreak, epidemiologists or disease detectives interviewed people to assess their potential exposure to the disease. This was in order to reduce the chances that they would make others sick and get proper medical care for those who got sick. If Ebola or any other infectious disease become a concern, the Center for Disease Control and Prevention, CDC, will issue public health guidance and sometimes risk classifications based on how the disease is transmitted. This guidance gets updated as more is known about a disease, so things may change. Risk classifications are generally determined based on how the disease is transmitted, such as by air, bodily fluids, or through animal or insect bites. They also take into account how long the infectious period is and the type of exposure to the illness. The Connecticut Department of Public Health, along with healthcare providers and local health departments around the state, follow the CDC's guidance, which may include interviewing you to assess your potential risk for infectious diseases. They may also ask you to monitor your health. For most infectious diseases, the risk factors are generally high risk. You had direct contact with a person who had symptoms without wearing any protective safety masks or gloves, or you were bitten by an animal or insect with the disease, and you are at high risk of getting the disease. Some risk. You have had close contact with a person who had symptoms and you used some precautions, such as protective gloves or mask, so you are at some risk for getting the disease. Low, but not zero risk. You had brief contact, like a handshake with an ill person, or being in the same room or traveling on an airplane with an ill person, and the type of contact puts you at low risk for the disease. Let's talk about what you might have to do and for how long if you are asked to monitor your health. If you fall under one of the CDC risk categories, you may be asked by your healthcare provider to monitor your health. The type of monitoring and length of time will depend on what kind of disease we are dealing with. Here's an idea of some of the things you may be required to participate in. Controlled movement. If you are in the high or some risk category, you may be asked to control your movement. This means you are not allowed to travel on public transportation, even if you are feeling well. All travel must be by private vehicle and must be coordinated by the health department. Active monitoring. People under active monitoring are asked to do health checks every day. A health check may include taking your temperature and watching for symptoms. The local or state health department will tell you how often the health checks need to be done and what they involve. Direct active monitoring. People under direct active monitoring are observed face-to-face by a local or state health department to assure that they are healthy. This may include in-person visits and/or using video to watch you take your temperature every day. You may also have to discuss any travel plans with the health department. Self-observation. Self-observation means that people should watch their health for possible symptoms. The health department can explain which symptoms to pay attention to. If you start to develop symptoms while observing, contact the health department right away. Self-monitoring. Self-monitoring means keeping an eye on your overall health, including taking your temperature daily. You do not have to report daily to the health department. However, if you develop symptoms, including a fever, separate yourself from other people and contact the health department right away. So, what should you be looking for? Here are some symptoms that you would want to report to your health department if you are being monitored. Fever, chills and sweats, weakness, loss of appetite, diarrhea, stomach cramping, headaches, changes in skin or rash development, sore throat, trouble breathing, any other symptom indicated by the health department. I know this seems like a lot, so you might be asking yourself, what if I don't know how to monitor my health? That's okay. Your health provider and health department will give you step-by-step instructions on what to do and when to do it. Keep in touch with them to answer your questions and report your temperature. If you don't know how to take your temperature, we have a video for that too. If you are planning to travel, other states and countries may have different policies about how they deal with infectious diseases. If you are being monitored, check before traveling for any requirements and restrictions at your destination. The public health departments in both states or countries will decide how to monitor you during your trip. The Connecticut DPH is committed to keeping people safe from infectious disease, and you can help us by doing the following. Follow any recommendations given to you by your health provider and health department during the monitoring process, including taking your temperature, reporting your health as directed, and following any movement restrictions you may have been given. This will make sure you get the proper care in a timely manner and prevent the spread of the disease to others.